Assalamu alaikum wa rahmatullahi wa barakatuh. Factor relating to the production of radiograph. Radiation quantity is the number of X-ray photon in the useful beam. The factor affecting X-ray quantity are milliampere. The X-ray quantity is directly proportional with milliampere per second. Number 2, kilovolt peak. X-ray quantity is directly proportional to the square of kilovolt peak. 3. Distance. X-ray quantity varies inversely with distance. 4. Filtration. X-ray quantity is reduced by filtration, which absorb the low energy photon of the beam. Radiation quality is the penetrating power of the X-ray beam. The factors affecting X-ray quality are kilovolt peak. X-ray penetrability is increased as the kilovolt peak is increased. 2. Filtration. X-ray penetrability is increased when filters added to the beam. Inverse square law. The law stated that the intensity of radiation inversely proportional with the square of distance measured from the source of radiation to the point of measuring the radiation intensity. As we seen in this figure, the intensity decreases with the square of distance. Factor relating to the production of radiograph. Factor related to radiation beam, and factor related to the object, and factor related to the X-ray film. Factor related to the radiation beam. Exposure time. It is the interval during which the X-ray are being produced. Exposure time is directly related to the total photon production. Thus, increased exposure time causes increase the quantity of X-ray. That's why exposure time has direct effect on the film density. Milliamperage. It related to the amount of electricity passed through the filament circuit. So, it is directly control the rates of X-ray photon production. Thus, it has direct effect on film density. 3. Kilovoltage. kV is referred to the potential differences between cathode and anode in the X-ray tube. The higher kilovolt peak, the greater is the potential differences, and the greater is the energy of X-ray photon. A tube film distance. This distance consists of a tube object distance and object film distance. The tube film distance affected the intensity of radiation. The tube film distance affects the exposure time directly. The distance proportional inversely with the intensity of radiation. The distance affects the dose of radiation because decrease the tube film distance make the X-ray beam more diverge behind the skin area and more tissue is irradiated, while increase the distance makes the beam less diverge and reduce the amount of tissue irradiated. Focal spot size. The focal spot, or called the source of radiation, must be as small as possible to get best image quality. So, any movement in the head of X-ray machine affect the focal spot size. Collimation. Collimator used to control the size and shape of the beam. Effect of collimation: reduce the amount of tissue irradiated and minimize the production of secondary radiation. fog is unwanted film density, blackness, and thus reduce radiograph contrast. Filtration. The effect of filtration is the absorption of long wavelength X-ray photon that have low penetrating power. The resulting of filtration of X-ray beam is hardened beam. Also, increased filtration affect the contrast and density, but in different way. The contrast is decreased, long scale, like the effect of increased kilovolt, while the density is decreased because when filtration increases, the result is absorption of not only long wavelength photon but even some of short wavelength photon. So the number of X-ray photon or quantity of radiation is reduced, so the density reduced. Equipment efficiency. Dental X-ray machine differ in construction and efficiency, so that the quality and the quantity of X-ray beam vary from machine to another. Factor relating to the object. The object is basically an absorbing X-ray medium. So, 2 points important about the object: thickness of the object and the density. Thickness of the object. Thick object require more radiation to make radiographic image. So it is often advisable to increase kilovolt or ampere and or exposure time in order to increase the amount of X-ray photon. And density of the object. Density to refer to weight per volume of the object. In dental radiograph, enamel of the tooth has highest density of all body tissues. Increase the density of the object, increase its ability to absorb X radiation. So, hard tissue like enamel absorb a great amount of radiation when compared with absorption of soft tissue like pulp. Factor relating to X-ray film. Reduction of secondary radiation. Secondary radiation include scattered, straight leak, or any other radiation that not belong to primary X-ray. Secondary radiation is undesirable because it reach all part of the film and produce film fog. Several ways to minimize this radiation, like using a small beam of radiation, proper collimation. In intraoral film, put a sheet of lead foil behind the film. In extraoral film, the grid is placed between the object and the film. Film and film storage. X-ray film must stored in light-tight containers because the silver bromide crystal in the emulsion are sensitive to light as well as to X-ray. Also, film must stored in lead-lined boxes to keep the films away from the stray radiation. Also, stored in a place away from excessive temperature or humidity, and we should use it before expiration. Intensifying screen is a device that converts the energy of X-ray beam to visible light, which interact with X-ray film and forming the latent image. Intensifying screen used in extraoral film to reduce the patient dose by converting the X-ray to light. So, one X-ray photon gives rise to many light photons. the number of X-ray required to produce the same density on the film is markedly reduced. Film processing. The latent image is formed when silver halide grains are exposed to X-ray. Then only the exposed grain will form the visible image by development, while the unexposed grain removed from emulsion by fixing and make a permanent image. As mentioned in previous lectures, it's either automatic or manual steps. The automatic processing is preferred because it's faster and result is better image quality. Ideal radiograph projection. The term image quality describes the subjective judgment by the clinician of the overall appearance of a radiograph. It depends on density, contrast, latitude, sharpness, resolution, and other factors. Ideal radiograph demonstrates certain image qualities include radiographic image that is sharp, radiographic image that is sharp like object, radiographic image that is the same size as the object. Sharpness is the ability of radiograph to define an edge precisely, like dentino enamel junction, a thin trabecular plate, and other detail, or measure how well the boundary between two areas of different radio density is revealed. Image size distortion or magnification is the increase in the size of image on the radiograph as compared to the actual size of the object. Image shape distortion. It results of unequal magnification of different parts of the same object, or the change in the shape of image as compared to the actual object due to improper alignment of the tube film or the object. Penumbra is the amount of unsharpness of the image. So, penumbra is the area of partial shadow. Umbra is the area of total shadow, and it exists only when the object absorbs all of the X-ray. Penumbra is created by the size of focal spot. The larger the focal spot, the greater the penumbra. Penumbra not only affected by focal spot, but also affected by tube object distance and object film distance. Object film distance should be as small as possible, and the tube object distance should be as large as possible. As we seen in this diagram, when the focal spot point, there is no appearance of penumbra. A small focal spot, small amount of penumbra. Large focal spot size, large amount of penumbra. Also, this figure shows the relation between the penumbra and the size of focal spot. Basic principles of projection geometry of radiograph. Source of radiation should be as small as possible. Tube object distance should be as great as possible. Object film distance should be as small as possible. Film should be parallel to the easily identifiable plane of the object. Central ray of the beam should be perpendicular to the film. The first three principles deal with image sharpness, while the last two principles required during exposure as a technique. Radiographic error and artifacts. It's classified into three categories according to technique and projection error, exposure error, processing error. Number 1, concut is a clear unexposed area result from positioning fault when the X-ray beam not completely cover the film during exposure. Backside exposure, when the film placed in wrong position, making the non-exposure side facing the beam. The result is the image with a pattern of the lead foil is evident. Double exposure, when the same film used and exposed twice to X-ray, resulting in excessive density and blurred image. Elongated image, vertical angulation of X-ray tube was too shallow. Shortened image, vertical angulation was too steep. Overlapping, due to horizontal angulation incorrect. Blurred film, excessive bending of the film during placement for exposure. Fingernail marks, resulting a black line when the pressure by fingernail on, as an example, put in the film, or sometimes we have fingerprint impression. Pale film, due to either underexposed or underdeveloped. Dark film, due to overexposure or overdevelopment. Completely clear film, when put in the film in fixer before developer or the film didn't receive radiation. Reticulation, it means crack of the emulsion when the subject to great change in the temperature between different processing solution. Note, the temperature must go from warm to cold. Wet and leak packets, when we have a black border due to light entering a poorly sealed film wrapper. Underdeveloped area, this appears as a clear area caused by incomplete immersion of the film in the developer, or stick the film in the developer to the side of the tank. Scratched film, when the film is processed in manual processor, the soft emulsion is easily scratched due to rough handling of the film. Developer spot, a black dot or dark spot on the film caused by drops of developer solution that was accidentally spilled on the film before it was developed. Fixer drop, white dot or light spot on the film caused by drop of fixer solution that was accidentally spilled on the film before it was developed. Yellow or brown stain or discoloration of the film due to contaminated solution or insufficient rinsing. Discharge of static electricity. This is ideal image. Thank you for your listening.